take-home messages before we see some more cases. We need protocols. In whatever we are doing, we need to have our protocols. We need to learn very good at traumatic extractions and surgery. We need to control the bacteria. We need, in most of the cases of socket grafting, open healing. You can use membranes, but I like to use wound dressings like Ora-Aid, Copac, Elemental. You can try the periacrylic tissue adhesives. So in the market, you can find some very nice wound dressings to cover the grafted sockets and to allow for open healing. And always we are using fully resorbable silicate beta TCP synthetics because in a consistent way, they give us the best quality of bone. And then when you place your implant with your surgical guide, if you will see how to use anatomical customized abutments, then you can facilitate the reconstruction of the soft tissues in a very simple way. Let's say case of immediate implant placement. This first premolar was broken, a vertical crown and root fracture. We could not save the tooth. This is the broken tooth. So in this case, we did the extraction. Again, minimally invasive extraction. We try not to damage the buccal plate and the soft tissues. You can see here the fracture. There was nothing to do to save this tooth. And in this case, we opted to do an immediate placement. So you see, it's very crucial to find the correct 3D positioning. We have guides. You need to use something to guide your hand to place the implant at the correct position and at the correct depth. How deep? Again, I'm telling you, we need to measure at least 4 millimeters from the platform to the zenith of the soft tissues. This is a basic rule, but it is a very helpful rule. And then we need to do some kind of dual zone grafting. It means that for these immediate placement cases, when we place our implant, then we fill all the space down to the hard tissues and all the space around the soft tissues with a bone grafting material. Again and again, I like to use synthetics. Here I use the crunch, the thin, small diameter particles of silicate beta TCP to do my dual zone bone grafting. And to seal this, now that I placed my implant and I achieved good primary stability, I will not place a stock abutment. I will construct and I will fit an anatomical abutment, because the anatomical abutment is following the anatomy of the extracted tooth. So it fits perfectly because it has a customized anatomy. It fits the anatomy. It is following the cervical anatomy of the tooth. So we have the ideal sealer to protect the graft. You see here, the abutment will protect the graft that we use for the dual zone grafting. And also it will guide the soft tissue healing. That's all that we do for these immediate placement cases. Then we need to control the bacteria. So every day, good hygiene and oxygen releasing gels every day. So during all the healing period, they will control the bacteria. Because if we get an infection, we'll have a good dehiscence and then we can lose the bone graft. This is after 10 days. You can see our technique and our gels, how they keep everything clean. Look at the monofilament suture, how clean it is. The abutment looks clean. Now the patient is able to brush it and then keep everything really clean. And after 3 months, you can see the maturation. During those 3 months, we do nothing at all. We just wait. And now we open the access hole, we unscrew it, and we remove the anatomical abutment. So you can see how nicely we generated the soft tissue profile with our abutments. This is the view from the top. You can see this popcorn effect. That's what happens when we do dual zone grafting. And this is why I use resorbable synthetics, because this eventually here, they will dissolve and they will give place to connective tissue. The grafting here and the activation of the implant will biomechanically will keep the volume, and also because we created here and we expanded the soft tissues and the restoration will follow this, will keep everything in place. So this is the simple technique: extraction, placement, dual zone grafting, abutment, and everything is ready. An excellent sealer for the underlying graft. It is supporting the soft tissues. It's guiding the healing of the soft tissues. This is the final result. So you can see the restoration, how it's following the anatomy of the soft tissues that we created, and we get excellent and stable results. So we try to keep it simple. This is another everyday case. This is a few weeks after the extraction. We're missing this premolar. It looks good after the healing of the extraction. We have some resorption. We have good soft tissues because when we did the extraction, we let it to heal spontaneously without any bone grafting. And always we need digital workflows, even if we think that the case is simple, because we analyze and we control and we design perfectly all the steps of our treatment. So try to have digital workflows for every case, make it your protocol. That's what I'm doing. And you see how nicely we will design what implant we will place, at which depth, at which position. Also, we see the defects that we will have around the implant. We do a digital wax-up. We know how deep we will place the implant because we know where the tooth will be to get a screw return restoration to give enough vertical space for the biological width. So before doing the surgery, with the plan, we know what we are going to do. And when we have a surgical guide and when we place with the guide the implant at the perfect position, this happens safely, this happens very quickly. So we have lots of time to take care and to deal with everything else. So you can see the bone defect here. We couldn't see it without the flap, but we could see it with the digital workflow. The guided drilling, and we place the implant so you can see the implant placed according to the digital plan. This is the defect that we knew that we'll have. That's the defect. And we can keep it simple, meaning I'm using Powerbone PUTTY. I control the bleeding, so I don't need the soft tissues here to bleed. I apply pressure with a gauze if I have some bleeding, so I need to control the bleeding before applying a small amount of the Powerbone PUTTY. So this will help the soft tissue healing. It will help all the bone here, this localized defect, to heal perfectly. I place again my abutment. Inside the abutment, I'm not placing PTFE tape. I'm placing silver plug. It is a small plug. I cut it here as much as I need. It's a plug that contains silver. So silver is also antibacterial, and it will keep controlling the bacteria inside the prosthetic canal of the healing abutment. Some composite on top, and I just reposition the flap around the abutment, monofilament stitches, and that's all. We just wait. We need to control the bacteria again and again every day. And when we do that, everything is simple, everything is predictable. I remove the abutment and implant is placed, bone graft is done, augmentation of the area is done, soft tissue reconstruction is ready. So minimally invasive protocols, logical protocols, proven protocols to guide all our everyday cases. The final restoration, you can see that we make a restoration now. We can make a restoration that complies with all the aesthetic, functional, and biological requirements. Again, I seal the access hole with silver-containing silver plug, this little plug. I'm not using PTFE tape. And a very nice result, and we know all the steps A to Z in advance because we have structured and solid protocols. Another excellent product is the Flex. I will show you how I'm using the Flex. It's a strip of graft. It's flexible. You can have it in 2 millimeters or 4 millimeters thickness. And I'm using it when I have these cases that I will place the implant, and at the same time, I want to do a simple but very effective lateral augmentation. So in cases like this one, how to deal with this defect, it might look complicated, but in most of the cases, it's quite easy to fix it. So we need to have, of course, a digital plan. We need to know in advance how much bone we have and if we are safe to place the implant. And if we are safe to place the implant, like in most of the cases, we can place a good implant. What we do is we raise the flap, we do the drilling. Before we place the implant, I like to use small decortication burrs to make some holes here. And through these holes, I will get more blood vessels, more cells for the graft I will use. So after the decortication, I'm placing the implant. I'm making my abutment. This is my customized anatomical abutment. And I'm using the Flex. So look how simple it is. You measure the area and you cut it with scissors and you take the amount of Flex you need and you use it instead of bone graft or instead of a soft tissue graft. So you use the Flex in these cases that you have already bone to place the implant, but you need something synthetic, you need something predictable, and you need something very easy to use and apply to do this augmentation. So you just cut the piece and you slide it in there. The small flap will keep it in place. You don't need to use sutures or tack because you place it once and you never re-enter the site. So you don't need to stabilize it. The flap will stabilize it. It's very porous, so it will absorb the blood and it's not washing away. So even if you have lots of bleeding, it will stay there, and this is a big advantage. And just, you see, you need to do small flaps and just reposition the flap around the abutment and to cover the Flex. If it's too big, just take your scissors and trim it. If it's too small, you have a very big piece to use as much as you want, or you can use it in 2 layers. You can do whatever you want to do the augmentation, but it's super easy. Just reposition the flap, just a few stitches, control the bacteria, and you see how nicely it heals. This is after 6 days, and this is after 4 months. Note how nicely the Flex synthetic graft helped the augmentation. So the combination of the Flex graft and the anatomical abutment give us a protocol to augment the area easily. And now we just take our impression. We make a very nice crown with zirconia and titanium. Again, these materials will attach to the soft tissues, and we will get the attachment and the soft tissue seal, silver plug, and that's it. We are ready. This is the final restoration. So with a very simple but well-defined protocol, in all our cases where we have some bone in there to place the implant, from there we can go to the final result easily, see the difference just by using a readily available Flex bone graft. And by loading the implant and using these materials, because they turn into bone and connective tissue inside there, we have long-term stability. This is after 1 year loaded. It's even thicker at the beginning. This is after we finished, and after 1 year, this is loaded in the mouth. Look how stable and healthy and clean everything is. And we can take our scans to do even measurements for the studies we are doing now, we are going to publish, and we analyze in detail everything, how the flex bone graft can help us with a normal big abutment or an anatomical abutment in a very simple but effective way to do this kind of everyday augmentations. Also, when you do wisdom tooth extractions, many times we need to do some bone grafting because we have deep pockets, we have bone loss. We have done studies, we have done publications about how you can use synthetic bone grafting materials to regenerate the bone here. And you need to regenerate the bone in order to avoid long-term pocketing behind the second molar. Like in this case, we have this mesiolingual impacted deep, quite deep third molar. You see all the bone here vertically is lost. We have buccally also a cyst. So we need to deal with it. We need to do our planning, and the treatment is to do the flap, clean surgery, minimally invasive surgery, so we remove as less bone as needed. And we cut the tooth into pieces. We remove the tooth. We remove the buccal cyst that we saw in the 3D CBCT. And after removing everything, we can do an analysis. So it was a dentigerous cyst. You can see here the cyst next to the wisdom tooth. Everything is clean. And what we need to do now, we can squeeze at the bottom, close to the nerve, some resorbable collagen. And to help the bone regenerate here behind the 7, we will use our synthetic Powerbone material. It's very easy with the syringe to apply it directly because we need to assist the bone down there and not to get pockets. That's why we use bone grafting materials in some of the wisdom tooth cases to accelerate the bone healing, to assist the bone healing, and avoid problems, perio problems in the long term. So you see, this is a CBCT after 6 months, how the bone grafting material regenerated all the bone distally to the second molar. See the difference? And not only that, it also helped us here to reconstruct, regenerate the anatomy. So when we had the third molar here and the cyst, really there is no anatomy. Everything is distorted because of the pathology and the impaction of the tooth. But when we do the extraction, when we do the bone grafting, and when these bone grafts regenerate high quality bone, the high quality bone also is reconstructing, is bridging back the trabecular bone and the whole anatomy. You see all the anatomy now is restored. We can see clearly the bundle of the nerve, and everything is fixed in a biological way. Bigger cases, we need to graft such cases because you see how much bone we have lost, how thin it is here. So we need to support the healing. We need to accelerate the healing. So after removing big cysts like this one, we need to create new bone and we need to restore the anatomy. So you see the wisdom tooth, a big dentigerous cyst. We do our surgery. First, we need to be very careful to remove the tooth without applying any forces, any pressure. So we cut it down into many pieces. And then we remove all the cyst. You see how big was the cyst down there. It was a dentigerous cyst. And when everything is clean, I do my grafting. For the part deep in there where was the wisdom tooth, I used the PUTTY because it was easy to use it with the syringe. And then for the very big bone defect of the cyst, I decided to use the high diameter, the big diameter particles of Powerbone, but even the paste and the particles are silicate beta TCP, because I want all this to heal nicely and to heal fast. So you see here the crunch, the particles that I placed. And after 2 years, you see how we have new bone. how the anatomy of the area is coming back. Just check the difference. And also we have good soft tissues on top of the new bone, and we don't have any pockets here distally to the second molar because we used the correct materials, osteogenetic, osteoinductive, and osteoconductive, high quality materials to regenerate quickly the highest quality of bone. So this is after 1 year, no problems, no pockets, no complications. For sinus lift, and I finish with these cases, the same. It's an excellent choice to regenerate the highest quality of bone inside the sinus. But what you need to know is that to use these materials only when you place at the same time the implants, because you need the implants to keep the membrane up, because just by itself, the material, because it's like a paste and because it has a very high quick turnover, it doesn't have the biomechanical stability by itself to keep the membrane up. So if you do the sinus lift, a big lift, only with the PUTTY, you will get new bone, but you will not get lots of height because mechanically the membrane will come down again. But if you place the implant, so you will get the tenting from the implant, it's a perfect and very easy choice to squeeze it before placing the implant and then around the implant, because this will give you excellent quality of bone, as you can see here, very quickly. So you will get, as we saw and we know from the histology, new trabecular vital bone around the implant. And you see here was the floor of the sinus, and now we did all this amazing, nice sinus lift, but it is a combination of the placement of the implant and the use of the synthetic silicate beta TCP. Also, you can use the crunch, but again, use these materials most of the times when you place the implants, because again, I have to stress out that the implant mechanically will do the tenting effect and will keep the membrane up, and the graft will do the rest of the work to create the bone. Okay, so we try to explain to you in every day why and how we use these materials. It's very crucial to have protocols. You can see that whatever I'm doing, I'm following my protocols, and by following protocols, I maintain my standards. I don't have surprises, and please follow the steps to have excellent results. Control the bacteria in all the steps. It's very essential. It's very important. Learn to do good extractions. Use high quality synthetics in your everyday cases, because this is how you will regenerate the best bone. Always have workflows, have surgical guides. You don't need surprises. And then learn how to use abutments to reconstruct and condition the soft tissues. So I would like to thank you. You can follow me on Facebook. I post there all my cases in detail, so you can see in detail every case, what I'm doing and how I'm using these materials. If you have lots of questions, please feel free to send me